7 medications that are causing you to be drowsy. Let's go over them and let's find out why. I'm Dr. Hassan, board certified trauma anesthesiologist. Welcome to my channel. Thank you so much for watching this video. I do my best to make these videos whenever I can in the spare time that I have. I'm a full-time father, full-time husband, full-time anesthesiologist, full-time avid workout fanatic, and I try to do my best to put these videos in when I can. So if you can do me a favor, like, subscribe, and please help me grow my channel. Without further ado, let's dive into it. 7 medications that are causing you to feel sleepy. Number 1, we go over the antihistamines. Antihistamines, what are they used for? Antihistamines are normally used for allergies. The old school antihistamines like diphenhydramine, which is known as Benadryl, affects your brain, gets through your blood-brain barrier up to your brain, causes drowsiness. This is also the same case with hydroxyzine and Unisom. These are all first-generation antihistamines. What you want to do is, if you have allergies, you want to get second-generation antihistamines. This includes Allegra, Xyzal, and Claritin. These antihistamines don't get up to your brain, so they don't cause drowsiness. However, if you do overdose on them, they will make it through to your brain and cause you to be sleepy. So that's why you hear a lot of people that sometimes say they get drowsiness when they take Claritin. Number 2, muscle relaxants. Now these are interesting because for the most part, we don't really know how they work. I'm talking about cyclobenzaprine, also known as Flexeril, also Soma and Xanaflex. These are all muscle relaxants. They help your body to relax. Anytime you think about it in your head when your body's relaxing, you're going to be more prone to being sleepy. This is because it's not fight or flight, it's rest and digest. And whenever you rest and digest, you feel more sleepy because your body's at ease. Interestingly enough, these medications, we don't really know how they work, but they work relatively well. But in my opinion, I would just try magnesium instead. Number 3, antidepressants. Now, antidepressants have a wide range of effects. Bunch of different types of antidepressants. What you need to do first is find out what kind of antidepressant you're on. Antidepressants work inside your brain. They either decrease or increase the levels of serotonin and dopamine inside your head. However, sometimes they do cause drowsiness, and in fact, the medication known as trazodone is barely even used for depression and anxiety anymore. It's really used as a sleep aid. So because of the fact that these antidepressants cause you to be sleepy and they work so well to put you to sleep, some people use them just to go to sleep themselves. Other medications like Lexapro and Paxil, as well as Prozac, all affect your brain and they can cause drowsiness. These medications are known as serotonin reuptake inhibitors. They increase the amount of serotonin in your brain and somehow they cause you to be sleepy as well. Serotonin and norepinephrine reuptake inhibitors also can cause you to be sleepy. These are primarily Cymbalta and Effexor. Now, people don't really understand why they cause you to be sleepy. Maybe a psychiatrist and neurologist might be able to chime in. For the most part, they affect your brain and they can cause drowsiness. Topamax, also known as topiramate, is used to treat seizures and headaches. This is number 4 on the list and it does cause drowsiness. Now, why does that make sense to me? It's because anything that's an anti-seizure medication decreases the amount of neurons firing inside of your brain. And because of that, if you think about it at a 3,000 foot level, if your brain is not firing as much, it's probably more prone to go to sleep. And that, in my mind, is why topiramate probably causes drowsiness. Number 5 on the list, beta blockers known as metoprolol, propranolol, and any other olol you can think of. These medications slow down your heart rate, slow down your blood pressure, and they do cause drowsiness. Propranolol actually is a beta blocker that's used to treat anxiety and it usually helps with public speaking. In my head, why does this make sense? Because if you're decreasing your blood pressure, any medication that's decreasing your blood pressure is going to naturally propel you to fall asleep faster. Now, obviously, over time, your body will get used to it, but theoretically, if you increase the dose, it can cause you to be sleepy because you're getting less oxygen to the rest of your body, and your body itself is preparing itself to go to sleep. Number 6, opiates. Any opiate is going to cause you to be drowsy, trust me, and they are very potent. Opiates are fantastic for putting you to sleep. They're also fantastic for stopping your breathing. That's because the mu receptors, especially on the spinal cord and in the brain, they propel a state of relaxation and sleep. They also get rid of any sort of triggers you have that cause anxiety. They also decrease the surge of norepinephrine throughout your body. They also decrease your heart rate as well. Because of this, opiates throughout your body will cause you to be sleepy, and naturally your body will upregulate the number of opiate receptors. And when your body increases the number of opiate receptors throughout, you're going to become resistant to the dose of opiates that you're taking at that moment. And because of that, the euphoria level is going to come down, and you might not get the same reaction that you did. And this means you might have decreased ability to fall asleep. It's natural with any sort of medication. The more you take it, the more your body gets used to it, the more you adapt to it, the less effective that medication is. And that's why you usually hear from pain doctors that you need to take an opiate break in order to reset your body and start up that climb again. And number 7, the best for last, any sort of benzodiazepine. Benzodiazepines are like Xanax, Valium, lorazepam, midazolam. All these medications work on the GABA receptors throughout your whole body, in your brain, and in your spinal cord. These receptors are known for relaxation. This is the same receptor that's hit by alcohol and anesthesia medications. They cause your body to totally relax. Obviously, we use much higher doses in anesthesia than you use when you take a pill at home. However, the general principles are exactly the same. Because of this, more than likely, if you take a Xanax, if you take a Valium, you're gonna feel sleepy and you're probably gonna fall asleep pretty fast. Now, just like opiates, benzodiazepines build up a tolerance the more you use them. Eventually, your body's gonna increase the number of receptors everywhere, and the effectiveness of the dose of Valium or Xanax you're taking is gonna come down. And this is exactly the same with alcohol as well. If you think about it, if you drink a little bit of alcohol once in a while, you will still feel tipsy. But if you're drinking 4 to 5 beers a night, 3 to 4 glasses of wine every single night, then alcohol is not going to affect you. And in fact, you're going to feel like you need to drink it or you're going to get shaky. And that's because the number of GABA receptors throughout your body are increased and the ability to quell them is decreased. So that's why anxiety comes when you have too many GABA receptors. And that's why anxiety goes when you plug those GABA receptors with a benzodiazepine. So those are 7 medications that can be causing you to be sleepy. If you're on them, ask your doctor about them, especially if you have excessive drowsiness, and maybe they can switch you to another one. And of course, my recommendation, magnesium is a fantastic supplement to take once in a while if you want to go to sleep and feel really good the next day. Thank you guys. I love you guys. I appreciate you tuning in for this episode. And if you can do me a favor, please like, subscribe, and share these videos. I'm trying to grow my content. Love you guys. See you on the next one.